Hello, everyone. I'm Dr. Andres Vasconez Samaniego. I'm a transplant physician and assistant professor at Phoenix Children's Hospital and Mayo Clinic BMT program. In this video, I'd like to explain, in very simple terms, how a bone marrow transplant can cure serious blood disorders such as sickle cell disease, beta thalassemia, and blood cancers like leukemia. Let's start with how blood is made. Inside our bones, there's a soft tissue called the bone marrow. You can think of it as the body's blood factory. In this factory live special cells called hematopoietic stem cells. I like to describe these to my patients as tiny plant seeds. From these seeds, your body makes red blood cells which carry oxygen, white blood cells which fight infection, platelets which can help stop any bleed. Each seed carries a recipe, your DNA, that tells it how to make healthy blood. As long as the seeds and the factory are healthy, your body makes new blood every day, and you don't even notice it at all. In certain blood disorders, something important goes wrong with the system. Sometimes this recipe is changed, and the red blood cells that come out of the factory may have wrong shape, may break easily, or may not be made in enough numbers. So people, as a result, will have anemia, pain episodes, and organ damage, frequent infection or bleeding, and the need for regular blood transfusions just to stay well. In other conditions, the problem is that the factory itself is failing. The seeds are damaged or missing, and the body simply cannot make enough blood cells on its own. So even though these diseases have different names, the root cause or the root problem is actually very similar. The original stem cell seeds or the bone marrow factory are not working properly. Bone marrow transplant is powerful because it does not just treat the symptoms. It aims to replace the broken factory with a healthy one. Here's how it works. First, we give strong medications such as chemotherapy and sometimes radiation to clear out most of the patient's own bone marrow. You can imagine carefully emptying an old damaged workshop. We try to make space so that there's new healthy seeds that can move in and grow. Next, we take healthy stem cells from a donor, often a sibling or an unrelated volunteer who's a good match, and we give them through the vein, very similar to what happens in a blood transfusion. There's no actual surgery to the bones themselves. The cells are given through an IV. These donor stem cells travel in the bloodstream, find their way into the bones, and then they settle in. Over the next weeks, if it all goes well, the donor cells start to grow and build a new blood factory, a new immune system. From that point on, the blood is made using the donor's healthy recipe, not the old faulty one. When this happens, the sickling or fragile red blood cells can be replaced with the stronger, healthy ones. Pain episodes and frequent hospital visits can decrease or stop. Transfusions may no longer be needed. The underlying disease is no longer in control of everyday life. This is what we mean when we say transplant can offer a cure. It is very important to say, though, and to say it clearly, that bone marrow transplantation is not an easy or simple path. The medicines we use are strong. People can feel very sick during this treatment. There's a risk of serious infections while the new immune system is growing. There's also a complication called graft versus host disease, or GVHD, where the new immune system from the donor can sometimes attack parts of the patient's body, such as the skin, the liver, or the gut. Very rarely, transplant can lead to life-threatening complications. Because of this, transplant is more than a medical procedure. It is a major life decision. It requires careful, honest conversations about risks and benefits. Time to ask questions to your provider and think about what matters most. Ideally, there should be a strong partnership between the patient and the loved ones and their medical team. Blood and marrow transplantation offers something that no other medicine alone can give, a real chance at a life no longer defined by their blood disorder. So just to recap, your bone marrow is your blood factory. In these serious blood diseases, the seeds or the factory are damaged. Bone marrow transplantation replaces the factory with a new one built from the donor stem cell seeds. When this works, it can change the story of the disease and truly offer a cure. My hope is that this explanation helps you understand what a bone marrow transplant is doing on the inside and why, despite its risks, it can be a powerful way to change a life. Thank you for watching.